Right now, a 16-year-old boy charged in the murder of a retired Chicago police officer makes his first court appearance. Lazarius Watts is accused of killing 73-year-old Larry Newman outside his West Garfield Park home last Thursday. Watts, seen here on the right in this surveillance video, is charged as an adult in the case. Prosecutors say he was supposed to be on home confinement at the time for an unrelated carjacking. Police are searching for a second suspect. The nation's top doctor today declares gun violence a public health crisis. He wants universal background checks and a ban on automatic rifles to try and save lives.
But the public health crisis designation comes as no surprise to employees at Stroger Hospital, where shooting victims often end up. Our Tara Molina got exclusive access today and joins us live from the newsroom with that. Hi, Tara.
Hi, Chris and Erica. They're seeing gunshot victims at Stroger's Trauma Center every single day, and they call this advisory a long time coming. The people seeing this firsthand told me they want it to be very clear. The impact of gun violence is felt by more than the gunshot victims they treat directly, and that's the approach they say this advisory finally addresses.
Cook County has the busiest trauma center in the United States. We were the first trauma center in the United States.
If you're shot in Chicago, chances are you're being rushed here.
We're in our shock trauma room for our trauma department.
771 people with gunshot wounds were treated in a room like this one at Stroger Hospital last year. And it's personal for Chief Medical Officer Dr. Claudia Fegan. She grew up on the city's south side, and her own direct experience with gun violence paved the way to her decades spent working here. Her take on this landmark advisory from the U.S. Surgeon General:
it's like long overdue.
More people are shot in Chicago than in New York City and Los Angeles combined. We're talking about a gun epidemic that's lasted decades in Chicago. These are the gun-related homicides in Chicago dating back to the 1960s. Every year, at least 300, with a peak of 750 in 2021. But Dr. Fegan says it's different right now. Harder. Why?
The more sophisticated the weapons, the deadlier the weapons, the less likely people are to survive.
Something she says they're seeing more and more often.
Where you might have been able to sew something back together, there's no tissue left.
The advisory points out more children between 1 and 19 die from guns than anything else in the United States.
We lost a 7-year-old this past week to gun violence.
It's one reason treatment here goes beyond medical attention.
I think our society writ large doesn't always see those patients as full, complex human beings.
Andy Wheeler is a clinical social worker here, and he's seen it all. He steps in to work with gunshot victims and their families while they're being treated here in the hospital, with wraparound services covering everything from violence intervention and mental health care to providing a supportive community.
I've met grandmothers who are sitting on a park bench who were shot waiting for the bus. I've met children who were shot in the back seat of their car while they were driving to school.
This landmark advisory is already being compared to the advisory on cigarettes back in the 60s. The major changes we've seen since then, the experts we talked to today say they hope this advisory has the same long-term impact. Reporting live in the newsroom, I'm Tara Molina, CBS 2 News.
Thank you, Tara.